We know that masks at this point are a very important tool to help prevent transmission of COVID-19, in addition to hand hygiene and physical distancing. Masks used when we look at states that have higher mask compliance and mandates for wearing masks, they tend to have lower cases of COVID-19. Also, we've seen that when people have been exposed to somebody else with COVID-19 infection, if they've been wearing a mask, they oftentimes are protected from getting infection themselves. So masks have demonstrated themselves consistently to be a very helpful tool in preventing infection. Important tools with wearing a mask. They have to be worn regularly. So it's really important that when you're going out, in addition to remembering your phone and your keys, to remember to take your mask with you. Easy to forget because these are relatively new and the things that we have to take with ourselves when we go out somewhere, but taking your mask is important. Wearing your mask as intended is also really important. So it has to cover both the nose and the mouth. And so oftentimes you see people wearing their mask underneath the nose, and that's a no-no because the droplets, the respiratory droplets, can be both spread from the wearer if their nose isn't covered, but also you're exposed, and those droplets can reach your mucous membranes of your nose and increase your risk for acquiring infection. So if you're not covering your nose and your mouth, you're still at risk. Other important things with masks, it's important not to touch the front of the mask. You can contaminate the front of the mask. It's a good idea to put it on and take it off by using the loops at the back of the mask or taking it off from the back and doing hand hygiene before and after you take it on and off. And then well-fitting masks work better than loose-fitting masks in general, both to protect yourself from droplets coming in and also to reduce the amount of droplets that might come out. An N95 is a name that's given to a respirator, which is a special type of mask that provides more filtration than other non-respirator type of masks. And so they're generally referred to as respirators, but it is a mask that you wear. It's been tested to see how much it can reduce as far as filtration through the mask. In the healthcare setting, we generally have fit testing to make sure people get a good seal with those. KN95s are more equivalent really to surgical or barrier masks. So they're very similar in name, but they have more filtration similar to barrier masks. They don't have quite the same level of rigor and filtration as the N95 respirators. KN95s look kind of like a hybrid between the N95 mask and a barrier mask. They have ear loops similar to a lot of the barrier or medical procedure masks. They have N95 in the name, but they are more similar to a barrier mask or surgical mask on that spectrum. And an N95 respirator is really the pinnacle or the most filtration that you can get out of a respirator. It's important that you're getting a legitimate mask, right? You want to get what you're paying for. The best way is to make sure that you're getting it from a reputable vendor. If you're buying it online, you may want to cross-check it or verify it with the CDC. Go to a credible source. They have a list of masks there to tell you what to look for to make sure that the mask that you're buying is what you're expecting to purchase. There are a lot of questions now about what mask to wear. CDC's revised their mask guidance to put some more nuance in there. And it really is to acknowledge that there are different levels of filtration by different masks. So as we mentioned, the N95 respirator is really the top-notch respirator as far as blocking virus and other particles that you'll breathe in. It has the most filtration. It's important if you're wearing one of those that you wear it appropriately. A barrier mask is the next level down. It's important that those have a nose wire, that they fit snugly around your face. They don't provide as much filtration around the N95. So the question comes up, well, should I always wear an N95? The biggest issue with the N95 versus the barrier mask is comfort. We see that people have a lot of difficulty being able to keep that N95 on. And I think one of the key tenets of wearing a mask is that you have to wear it, right? Masks only work if you're wearing them appropriately. They don't work as a chin strap. They don't work if your nose is showing. They don't work if they're loose fitting. And so if you have difficulty keeping an N95 on consistently, then you're not going to get that protection. Also, if you're not wearing it appropriately, if you don't watch the videos and educate yourself on how to get an appropriate seal, you may not be getting the same level of protection that you think you're getting by wearing that over a barrier mask. And so what the CDC really recommends is that you wear the mask that's as comfortable as possible so that you can wear it consistently. Because really the most important part while you're in the grocery store is that you keep that mask on the whole time. If you have an N95 on and it fits well and you can wear it the whole time, then that's great. But if you're having to take it down halfway through your grocery trip, then it really isn't providing you the protection that a barrier mask would be if you could wear that consistently throughout that grocery store shopping trip. The surgical masks have been around for a long time. Everybody's familiar with those. Obviously, they were invented for surgeons to wear during operations to protect the patient from the surgeon's mouth, but they also protect the wearer from respiratory droplets coming in as well. Seen in that used in the healthcare environment and very important there. Protect against the large respiratory droplets that COVID-19 patients can produce when they cough. So very important, very helpful tool in the healthcare environment. And also, obviously, they're worn outside the healthcare environment as well. Cloth masks still work. They do not provide the same level of protection that you see with a barrier mask or medical procedure mask or an N95 respirator, which is the top level of protection that you can get. If you wear a cloth mask, and they're more readily available, there's some important things that you need to know about them. They need to have at least 2 layers of fabric, if not more. You need to make sure that they fit appropriately, that they fit snugly, that they're covering your nose and mouth, there's not large gaps around the side. They need to be cleaned regularly. That's a big issue. You need to wash them at least once a day, or if they're soiled or look dirty. And then they need to be dried after they're cleaned so that you make sure you kill any bacteria or any other issues that might be on that cloth mask. So you still can wear a cloth mask, and we don't want people to be scared away from those in case that's the only mask that they have available to them. But it's important to know that you have to wear it appropriately. It doesn't provide the same level of protection that you're going to have with barrier or medical procedure masks, surgical masks, or the higher level, the N95 respirators. The issue with masks with valves, and those are predominantly seen on N95 respirators that have a valve, is it allows the wearer to breathe out and it allows air to escape. So it protects the wearer from incoming droplets, but it's not as good as preventing droplets from the wearer going out to other people. And so if the wearer of the N95 mask with a valve had COVID-19 infection, for example, they might still be able to transmit out through that valve. So it's not as good as an N95 alone for protecting the other people outside of the wearer if the wearer were to be infected.